Hello and welcome. Today we're diving into a less commonly discussed, but important, condition affecting the urinary system, bladder diverticulitis. We'll explore what it is, why it happens, how it presents, and what can be done about it. Let's begin with the causes. Bladder diverticulitis doesn't develop spontaneously. It's almost always a consequence of long-standing urinary obstruction and increased pressure within the bladder. This obstruction can stem from several factors. In men, the most common cause is benign prostatic hyperplasia, or BPH, an enlargement of the prostate gland that squeezes the urethra. Other potential causes include urethral strictures, which are narrowings of the urethra, bladder neck contracture, a scarring condition that restricts urine flow, and less frequently, conditions affecting the nerves that control bladder function, known as neurogenic bladder. Essentially, anything that persistently hinders the bladder's ability to empty completely can create the environment necessary for diverticula to form. To understand diverticulitis, we need to consider the underlying anatomy and physiology. Diverticula are essentially outpoachings or small sacs that form in the bladder wall. When the bladder persistently strains against an obstruction, the inner lining, the mucosa, can herniate or push through weakened areas in the muscle layer of the bladder wall. These areas of weakness are often where blood vessels enter the bladder. These outpouchings don't effectively contract with the rest of the bladder during urination. Urine tends to stagnate within them. This stagnant urine becomes a breeding ground for bacteria, leading to infection, inflammation, and ultimately diverticulitis. The inflammation further weakens the diverticulum wall, potentially leading to complications like rupture, although this is rare. Bladder diverticulitis isn't extremely common. It's difficult to pinpoint the exact prevalence because many individuals with diverticula remain asymptomatic. However, it's clearly linked to the prevalence of the conditions that cause bladder outlet obstruction. Therefore, it's more frequently seen in older men due to the high incidence of BPH in this population. It is quite rare in women and children unless there are congenital abnormalities or underlying neurological disorders affecting bladder function. Studies on the precise numbers are limited, but awareness of risk factors helps to identify potential cases. The symptoms of bladder diverticulitis can vary. Some individuals may have diverticula for years without experiencing any noticeable issues. However, when infection and inflammation occur, symptoms typically emerge. These can include frequent urination, urgency, a sudden and compelling need to urinate, dysuria or painful urination, and nocturia, the need to wake up and urinate during the night. Hematuria, blood in the urine, can also occur, especially with infection or inflammation. Patients may also experience suprapubic pain, which is pain in the lower abdomen above the pubic bone. In severe cases, systemic symptoms like fever, chills, and flank pain may indicate a more serious kidney infection, as the infection can spread upwards from the bladder. Diagnosing bladder diverticulitis involves a combination of clinical evaluation and imaging studies. A thorough medical history and physical exam are the first steps, focusing on urinary symptoms and potential underlying causes like BPH. A urine analysis is crucial to identify infection, looking for bacteria and white blood cells. Imaging studies are key to visualizing the diverticula. A cystoscopy, where a thin, flexible tube with a camera is inserted into the urethra and bladder, allows direct visualization of the bladder lining and any diverticula. A CT scan with contrast or an intravenous pyelogram (IVP) can also be used to identify diverticula and assess the overall urinary tract. Avoiding cystoarthrogram VGU can also be helpful to evaluate bladder emptying and detect any reflux of urine into the diverticulum or ureters. Bladder diverticula can be broadly classified into two types: congenital and acquired. Congenital diverticula are present at birth, resulting from a weakness in the bladder wall during development. These are less common. Acquired diverticula, as we've discussed, are far more frequent and develop later in life due to obstruction and increased bladder pressure. Additionally, diverticula can be categorized based on their size and number. Some individuals may have only one small diverticulum, while others may have multiple, larger ones. Treatment for bladder diverticulitis depends on the severity of symptoms and the underlying cause. Asymptomatic diverticula may not require any treatment, just observation. If there's an infection, antibiotics are the first line of defense. Treating the underlying cause of bladder outlet obstruction is essential. In men with BPH, medications like alpha blockers or 5-alpha reductase inhibitors can help relax the prostate and improve urine flow. In some cases, surgery to remove the prostate tissue may be necessary. For patients with urethral strictures, dilation or surgical repair may be required. Large or symptomatic diverticula may need to be surgically removed, a procedure called diverticulectomy. This can be performed through open surgery, laparoscopically, or robotically. Post-operative catheterization is usually required to allow the bladder to heal. Preventing bladder diverticulitis primarily focuses on addressing the underlying causes of bladder outlet obstruction. For men, regular check-ups with a urologist, especially after age 50, are crucial to screen for BPH. Early detection and management of BPH can help prevent the development of diverticula. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can also contribute to prostate health. Prompt treatment of urethral strictures or other urinary tract abnormalities is also important. The prognosis for bladder diverticulitis is generally good, especially when the underlying cause is identified and treated effectively. However, untreated diverticulitis can lead to recurrent infections, bladder stones, and in rare cases bladder cancer within the diverticulum. Recent research has focused on less invasive surgical techniques for diverticulectomy, such as robotic-assisted surgery, which offers smaller incisions, less pain, and faster recovery times. Furthermore, research is ongoing to better understand the role of inflammation in the development and progression of diverticula, which could lead to new medical therapies in the future. Ultimately, early diagnosis and appropriate management are key to preventing complications and improving the long-term outlook for individuals with bladder diverticulitis.